Whenever you're ready, Bridge.
Hello.
Hey,
How's it going?
He's just-
Bridget, CCD.
just fighting at it. We can't do anything. He's just too agitated. She. Sorry.
So she's awake, she's conscious, and
No.
Nah, she swears every now and then and just making sounds, I guess.
Trying to lash out
Yeah,
with
yeah.
her own, isn't it?
But only with that left hand, not with the right.
could we roll her onto her side just so that we can give her a better opportunity to breathe? Are we able to manage her?
There's a puddle of vomit just under her head there, you notice as you turn around.
That arm out. How's her perfusion? How's her colour?
She's pale.
Okay. Has she radial pulse?
She has a radial pulse of about 130.
And she's shouting and swearing. Is
She's
that correct?
grunting, and every now and then she swears at you.
Okay. Are her eyes open?
Not to voice.
Okay. And does she respond to a shoulder squeeze?
To a shoulder squeeze, she swears at you,
Okay.
opens her eyes to you, and tries to move that arm towards you, but the other arm's not moving at all.
Okay, so this one. So I just a little bit confused. Is the movement purposeful, or is it like a seizure? Is it a twitching kind
It's
of
like flailing around.
anxious kind of movement?
Mm.
Yeah, okay.
It's not a seizure.
Paul, can you try and get some monitoring on, please?
Mhm.
Just as much as we can in the position she's in. So can we get some history from her husband?
Yeah, he says she had a migraine. She had a migraine this morning that she's complaining about, and I've gone out to golf, and I've been gone for about 4 hours. So I'm just found her when I came home, and just that one leg and arm moving around, but the other one not at all.
Yep. Has she medical history?
She's on this medication called tritase,
Mm-hmm.
but I don't know what that's for. And other than that, she's usually fit and healthy.
Okay, yeah. So,
She's really flailing around with that arm. She's, and leg. It's difficult to.
okay. So is Damon able to restrain her, or is he safely
Yeah,
able
he
to?
can restrain her. Yeah.
Yeah. So just keep yourself safe. Try not to let her hurt herself.
Just one arm.
Yeah, and just keep moving that. And at the moment, we're happy with her airway. She's breathing adequately. What are her
Breathing at
stats?
about 36,
Yeah.
saturating at 92.
Okay. And her colour and her perfusion looks okay.
She's pale.
Okay. Would you pop on some oxygen, please? Stats of 92,
92.
staying at 92, and is it a good trace?
Yeah.
Yeah, okay. After that, then I'll get you to do a temp on her blood sugar, please. And I'm just going to have a quick look at her head to toe. Her pupils.
They're 4, but the right is sluggish.
Okay. And does she have any signs of injury?
No,
Hematomas?
no.
Nothing like that. Okay. And when I look at the rest of her injuries, rash,
As you see her.
or anything, so the rest of her looks well and healthy. Yeah.
10.
Okay.
Temperature is 36.
And Damon, can you try and reassure her, try and
It's
help
all
her
right.
calm down?
BSL.
BSL's 4.2.
Okay. Does she have diabetes?
She's
She's not on any medication?
No, just that
She doesn't
try.
inject?
I don't know what that's for though.
Okay. And her right pupil is sluggish.
Yep.
Her left side is moving, but her right side isn't.
Yep.
Yeah. Okay. So it looks like she's got a stroke pattern. Her level of consciousness is altered, and that's making her quite difficult to manage. I think we need IV access, but that's potentially going to be difficult. Paul, would you have a look at her?
Do you want to see if I
Her
can
left
still
arm
on it?
or her leg, wherever you can access safely without getting yourself hurt.
Yeah, she's still quite agitated with that left side.
Yeah, and that vomit, there's no more vomit. No, okay. Have we got a blood pressure?
Nope.
No. Are you doing okay there at the moment?
Yeah,
You're
it's all right.
managing her okay?
It's all right, Shirley.
Yeah, okay. So what time did her husband see her last?
I went to golf at about 8, and it's like 2 now.
Yeah.
Blood pressure is 95 on 50.
95 on 50.
Mhm.
Okay. So you went at 8.
Yeah, and I got
Yeah.
back just a bit before 2,
Okay.
and she was lying there like slapping the ground, and
Yeah. And what time is it now?
2:15.
Okay. Yeah.
I called you guys straight away.
And before you left, she was complaining of migraine?
Yeah, she's had a migraine. She gets them occasionally,
Yeah.
but she usually just looks after them and
Mhm.
puts herself in the dark room and looks
Yeah.
after that.
Okay. Yeah. So she's outside the window for an acute stroke, and she's also a recent history of a migraine, which often presents or can present with a stroke as a stroke mimic. So we need her to go to a stroke centre, but we don't need to alert for an acute stroke at the moment. What we do need to do is get her comfortable and safe so that we can manage her and get her obs better. How did that access go in okay?
Yeah.
Yeah.
He's good at cannulating.
Excellent, yeah, it's better than demo.
Yeah.
Have her sats come up on oxygen?
Not particularly. A little bit, up to 93.
Okay,
Still quite agitated, moving around. Damon's really starting to struggle holding her there.
okay. And her heart rate,
As you see it,
as I see it, and her blood pressure's on the low side.
95 on 50.
Okay. Would you draw up some ondansetron for her, please? Would you also draw up some, and then organise some fluids? We'll have that ready. Yeah, I'm just going to do a quick assessment again. Her airway's clean.
Airway's clean.
Yep. She is breathing.
Yeah.
Yeah.
She's really thrashing around that side though.
Yeah.
Really,
Okay.
really thrashing.
And her
around.
GCS.
Is, as you saw before. So
Painful stimulus. Her
Pain.
eyes are opening.
her eyes will open to that,
So it's
Yeah.
2.
and she'll swear at you, or actually she'll just grunt at you.
Grunt out, maybe.
Yeah.
So that's
Uh,
2. And is she localising?
she tries to, yes.
Yeah, okay. So it's 5. So her GCS is 9 at the moment?
Maybe push that 4 on the ends.
Yes, please. Yeah. She's still really agitated?
Really agitated.
Yeah, okay. Can you drop some fentanyl, please?
Okay, no.
Yeah, 100 mics in 10 mils, please. Does she seem to be in pain? Is it like is she agitated with pain?
She'll, when you give her a squeeze, she'll agitate that, but she's just lying there.
She's not localising to her
No.
head or anything like
No,
that?
she's just thrashing around with that arm and that leg. Just
Okay. So,
Need that on it.
That's fancy.
she does localise though when you
yeah.
if you hurt her.
Yeah.
Yeah.
Okay. So we're in a difficult situation here where we could sedate her to be able to manage her more safely. I think first we'll just give her a little dose of analgesia because if she's got a headache and a stroke and it's extremely painful, that might be enough just to get her to calm and comfortable, and then the reassurance will keep her. So,
So you got the fentanyl here.
mhm.
How much do you want?
Yeah, her blood pressure's 95.
95.
Yeah, so we give her 25 mics, please, and she's 67.
Yep.
We'll just give that a minute to work. No other history available from her husband?
No.
Family history?
No,
social
she's
history?
normally fit
Yeah.
well.
Mhm.
Yeah.
So has that helped or is that helping
No.
at all? It's not helping, okay. Could you draw up some droperidol, please? That's the next option. If we're going to have to sedate her, we can give her an over 65-year-old dose of droperidol on the new CPM, and hopefully the sedation will help to make her comfortable, and we'll be able to transport her more safely. Is that okay? You happy to draw that up? So it's 5 milligrams for 67-year-old rather than 10.
Alright.
We don't actually have any, but we can pretend.
Yeah.
So no change.
No change. Still rat thrashing around. Difficult for Damien to look after.
Yeah. Her airway is clear.
Airway is clear.
Yeah. Any change in her pupils?
No, both are equal at 4, but the right is very sluggish.
Yeah. Okay. So when you have that, will you give that to me? And I'm just going to hold it for 1 second. There's a couple of things I want to check before we do that, just before we make the final decision on sedating her at this stage. I want to check her blood sugar again. 4.2 is very close to low, and if that's dropped a little bit more, then I think we should correct that.
So as you
Thanks very much. So just do another quick BSL, and then we'll get that fluid challenge running as well. So does she look dry? You're poorly perfused, her mouth isn't dry,
Not particularly.
Second base,
tempting skin, nothing like that.
BSL stayed the same.
Still safe.
Yeah, 4.2.
Okay, guys, I'm going to give her some droperidol to sedate her. We need to get organised so that we're set up, that we can manage her once she's sedated. She may decrease in consciousness again. So I think the first thing we could do is slide her that way a little bit so we have some more room. Can we do that? Slide her down there. Excellent. Yep. I'll get you to do an airway setup over here, so BVM, suction, OP, and we'll get the nasal, I'll be getting the nasal end-tidal on her. How are we doing that? Thank you. How are you doing, Damon? Are you getting tired?
Oh no, it's okay, Shirley.
Yeah. Thank you.
That works. Yeah, cool canister.
Excellent. So I have the end-tidal on, suction ready. We've got her supported. Will you secure that line really well so we don't lose it while she's flailing about? And she's safe and comfortable in this position. If she needs resuscitation, I'll start to ventilate her here, and we'll get her onto her back to transfer her in a few minutes. So for the moment, we're going to keep her in this position. Ulster all the same?
No change.
Yeah. Her end tidal staying the same?
Yeah, end-tidal.
Yeah. Okay. So your job is going to be continuing to hold and support her and reassure her. Paul, I'm going to get you to do the drug administration, and I'm going to keep an eye on her airway and breathing from here. And then we're expecting another 10 minutes after that, where she'll need to be held and looked after until we expect the sedation to work. So is everybody happy? Yeah. Okay. So I'm going to give you that. You can give it to her in her shoulder or her thigh, whichever doesn't have too much subcutaneous fat. Yeah. Shirley, sharp scratch in your leg. Relax now, Shirley, it's okay. We're looking after you.
Droperidol's in.
Okay. That's to 1043.
What was your dose?
5 milligrams.
And is the fluids are up?
Mm-hmm. Yeah,
What's your
I'm
plan
ready.
with the fluids?
Hmm?
Do you have a plan?
250 mils, and then we'll reassess. So I'm just watching her obs now. Is anything changing?
Blood pressure is still, what's come up to 100 on 50.
Mm-hmm.
Nothing else has changed.
Okay. While we have a couple of minutes waiting for this to work, would you get the scoop and the stretcher so that we're ready to extricate her? And we get organised to get her moving. Any change?
How long between when you can give you, how long until you can give your next dose?
15.
15 minutes. Has she started to quieten down with the agitation?
Okay. Has anything, is her response still
Response has
decreased?
decreased as well.
Okay. Is her airway okay?
Airways as it
Supporting
is, it's fine.
Her end-tidal waveform
Remains
adequate.
adequate.
Yeah. Her SATs?
SAT's 95.
Okay. And the moving's less?
Yeah, she slowed that right down.
Okay. Emma, will you have a look at that fluid, see how much has gone in?
full 250's gone in.
Okay, you turn it off for now.
Yep.
And when we have an opportunity here while we're waiting, could I get you to do a quick 12 lead?
Yep.
Is she okay to not be held at the moment?
Yeah, she'd stay on the side.
Okay, I'm going to stay here on her airway and breathing.
Do you have any other than a 12 lead? Do you have any other plans before you?
Depending on her level of consciousness, I might insert a nasal airway. I have the OP here as my emergency if I need it. We're going to transfer her onto the stretcher and get her back on her side. In circumstances, I'm going to notify the hospital. And do another set of obs. I'm still a little bit concerned about that blood sugar, so I think I'll check it again after all this energy has been used.
Remains at 4.2.
Okay, yeah, so I'm not worried about that as long as it's not dropping away. The fluids are just going to be stopped for now. Is there anything I'm forgetting yet? Can anyone else think of anything you're concerned about? You don't talk much.
They're shy.
Yeah. Yeah. You're not worried about anything else, so you don't have any other information at this stage.
You've got all the information.
Okay.
I'm just a driver.
Just the driver. All right, that's not
For the cheap it.
GPIP and a driver.
Yeah.
Got that one.
Pro.
Okay.